All right, good afternoon, everyone, and welcome to our professional development program. We are delighted to have Nate Verhagen and Nate Wolfrath here with us today to talk about ChatClinic, which is an AI tool for patient interaction and education. And Nate, thank you so much for being here with us today. I will let you both introduce yourselves and your role here at MCW and in the development and use of this tool. So we really looking forward to hearing what you have to say about it. Again, thank you.
Sounds great. Thank you for the opportunity. Nate and I are really passionate about AI and talking about it and sharing kind of about what we think the potential of this is. So, any chance we get to talk about it is very exciting. So, I'll give you a little bit about me. So, Nate Verhagen, I'm a fourth year medical student at the Medical College of Wisconsin. I'm applying otolaryngology, head and neck surgery. And I started to get into this space my first year of medical school. I did surgical data science research, and then as AI has really taken off in the recent years, I was well positioned to ask some of the questions and start to formulate some solutions of how we can approach AI in medicine. And then that's kind of how Nate and I got connected. So I'll let him give a brief introduction of himself.
Hi, Nate Wolfrath. You get two Nates today. Um, I took a little bit of a different route. I'm also a fourth year medical student. I'm going into internal medicine, but prior to medical school, I did my undergrad in computer science and was in the software engineering and machine learning world for a little while. So that's the perspective I'm bringing on this.
Awesome. And our presentation is titled Chat Clinic and the Future of AI in Healthcare Education. Not everyone's going to become a data scientist or a entrepreneur in the AI space, but I think our hope is that we can excite people about the potential of AI, see the vast potential and why everyone is so excited about it and why we are excited about it, specifically with our story of Chat Clinic. And then thankfully, Nate's so knowledgeable. He gives a really good crash course on the history of AI and some key concepts that I like to use moving forward, and hopefully you guys can pick up some of the language and terminology. So with that, we'll get started. Um, so I wanted to start with the inspiration parts. This is Dr. Thomas Fogarty. In the 1950s, he was actually a surgical scrub tech, and he was observing how surgeons would clear blocked blood vessels, and there are super high mortality rates. And Fogarty, in his position as a scrub tech, kind of saw an opportunity to change this field, the way we treat these patients. So this is the balloon catheter. So he combined his surgical knowledge with his fishing hobby, and then crafted this tool using a latex glove, a plastic catheter, and then the fly tying techniques. And this invention, which was patented in 1969, was the first balloon catheter, and it completely changed how we do minimally invasive procedures for removing thrombi from blood vessels. And initially there was a lot of criticism of this tool, but it's really changed how medicine deals with thrombus, and it saved so many lives. So I think the takeaway of now Dr. Fogarty's story is that groundbreaking ideas can come from anyone in any stage of life. And there's always going to be resistance to change, but I think that perseverance and his story just makes you realize the potential of anyone at any stage, and especially as medical students like Nate and I. Stories like this is stuff we can really resonates with us and gets us excited. So this is kind of the quote, and why we get excited is the world is more exciting when we believe that anything is possible. So how does that apply to AI is the key thing. So we made this figure, and this figure it was a reaction coordinate diagram. If you remember chemistry way back in the day, you'd have your reactants going to your products, and then there was this massive amount of activation energy needed to get from a reactant to a product. And in this case, how we view this is going from ideas to products. So in any professional space, you identify problems, and there's ideas and solutions potentially to solve them, but the amount of time, skill, and cost. These barriers to realization are usually really vast, and it's really difficult for us to take an idea and create a prototype or create a solution to these product problems. What AI does is it's really a catalyst to decrease some of these barriers to realization, and it allows small teams like Nate and I and another software engineer and like a really small marketing team to accomplish a lot more with a small multidisciplinary motivated team. So that is why AI is really exciting to us. So that kind of brings us to how does this apply to you guys? How does this apply to institutions as a whole? And what I encourage people to do is always ask these questions of how can AI be applied to my daily workflow? And every position within a hospital system within an institution will ask different questions for this. So I'll give you an example of how I thought about this as a student. So this was actually on my internal medicine rotation. I'm using Consensus, which is an app, and I don't know if you can totally see the screen, but really I'm asking the question of when you should transfuse blood at different hemoglobin levels, because I had heard somewhere along the way some people transfuse at 7 and some people transfuse at 10 with patients with a recent history of myocardial infarction. So I want to know what data exists for that. And instead of doing a massive, kind of lit review, what I was able to do is actually use this Consensus tool, and I actually pulled in the exact papers, the exact studies. There was a randomized control trial reality that identified or that basically set these guidelines for hemoglobin transfusion protocols. So that's just one example of applying AI to my life as a student, but it's just this constant pursuit of asking these questions, which brings us to kind of how we're getting to ChatClinic. So OSCEs are these objective structured clinical examinations, and usually there's about 6 of them every year where we interact with actors who are being brought in from the community, and they're simulating a pathology. So it could be they're presented with appendicitis, but we don't know that going into the room. So then we're interacting with these patients. They're really, really useful as an educational exercise, especially assessing our skills. But they're very resource intensive. You need to bring in these actors to come in on a certain day. They need to be paid, and we each have limited time with them. And these interactions improve our clinical reasoning. They help us develop this clinical gestalt that really only comes with interacting with patients over and over again. And one of the things we identified early on with AI is AI has a very awesome ability to simulate interaction. And that's what ChatClinic ultimately is. It's a web-based medical education tool that uses large language models to simulate patient interaction. That is the one-liner idea of what ChatClinic is. And in terms of the actual workflow of what we had thought about was just as you would in a normal clinical setting, you take this patient history. We want to be able to order clinical tests, and then we would provide an assessment and plan for that patient that we had this entire interaction with. And at the end, because AI is very flexible in how we're able to use it, it would generate AI-generated feedback. So people could learn and realize, oh, I should have asked that question. I'll ask that question next time I interact with a patient with abdominal pain. So that's kind of the final component of it. So this is ChatClinic in a nutshell. And when I first started to propose this idea to Nate, me having the surgical data science background, it's great and all, but it's not strong enough to truly take this idea and run with it, which is why I knew we needed to get assemble a multidisciplinary team and a really talented team. So this is a comic that I really resonated with me as someone who's really interested in AI and thinks I know a fair amount, but it talks about who wants to be on an AI safety committee. And everyone is going to put their hand up who's interested in AI, because I know a little bit about AI. I'd love to be on this committee. Anything with AI, I'd love to help advise an institution for it. But then the next question is, who knows what random seed does? And it's kind of a quick reflection and brings you back down and realize, wow, I wasn't a classically trained computer scientist or software engineer where this question is fairly easy. So this was a question I brought up to Nate. This is a screenshot of a text message, and I just said, "What is random seed?" And Obviously, he knows what random seed is, and he goes into this great detail. My point in sharing this story is AI is a really hot topic right now, and knowing when to apply it and when not to apply it is really important. And having people that you know you can go to who are experts in the field has been critical to our success in ChatClinic. So with that, I'm gonna turn it over to Nate. He's gonna go into some of the technical components of ChatClinic. I'm not too technical. I hope it's just more exciting for you guys to see how this is all done, and maybe it gives you guys some ideas for the future of pharmacy. So.
Yeah, and as I go over some of this, I hope that you can take away not only kind of how ChatClinic is structured a little bit, but also how some of these concepts could be used for whatever AI applications, could be relevant to the pharmacy education world. So this is kind of the initial drawing of how we would create ChatClinic. It's not very complicated, a couple lines in a database. And if you go to the next slide, the UI looks like I made it in about a week, which it's come a long way since then. But this is kind of the minimum viable product, and you'd be surprised. The time to implement something basic with how good the AI tools are now is not too bad. You can get up and running, and that's kind of lowering the activation energy like we were talking about. So this is a recent version of ChatClinic, just so you can kind of see what it is. It's hard to read the text, but this is a patient presenting with abdominal pain. And the student typing in the text box at the bottom is kind of taking a basic history, asking questions, when did this start, ordering labs, and collecting clinical information. And so at the end, the student will give their assessment and plan and then get some feedback on how they did taking the history and how their clinical reasoning was. This is kind of the new version that we just rolled out, which is a new UI. It's kind of, we made it to make the EHR a little bit with different panels of information to try to make the experience a little bit more realistic. And this is kind of the next step for us. So we're making this build a patient tool, which is kind of a new workflow where a preceptor or someone will specify what kind of patient they want. Let's say you want a patient with pneumonia, and you can kind of give some details about it. And then eventually, in a very short period of time, like within minutes, we can spin up an AI version of this patient, and you can practice taking a history and all that. So this is kind of the next phase that's coming up.
Yeah, and I'd love to add, something with this build a patient. I think what this is doing is taking some of those clinical vignettes that students will train on or will read in a question stem, and it makes that patient come to life. So with with a really talented software engineering team, what we've done is you can actually paste a clinical vignette into the context window and generate the case. And really what it's doing is turning that just those words and creating this artificial intelligence patient, which is really exciting and really decreases the resistance for a further adoption of ChatClinic. So when people do have ideas, and hopefully more and more people within the institution will continue to have these ideas, we're able to really, really quickly and seamlessly create their AI patient so that it can be quickly utilized in case-based discussions.
Yeah, and I think one last point on that, there's a lot of workshops and OSCEs and things people have developed and curriculum people have developed that already exist that with something like this can easily be translated to an AI-based education tool. So just some really brief history on artificial intelligence, the 2-minute AI 101. Artificial intelligence really is not anything new. So over 50 years ago, kind of was the first chatbot. It's called Eliza. Fast forward a little bit. This is Deep Blue beating Grandmaster Garry Kasparov in a game of chess. And then more recently in 2011, we had the best Jeopardy players losing to AI. And you can kind of see over time how things have gotten more flexible. So chess is complicated, but it's a game with very strict rules. The pieces can only move a certain way. And then in 2011, there's a language processing component, and it's a much more complex system. And we've all kind of been consuming AI for quite some time. So these are all tools. If you drive like me, you use Google Maps pretty frequently, or Netflix uses AI to say, oh, you like this movie? Well, then you probably would like this movie as well. So AI has been around for a long time, which kind of prompted me to ask the question, what changed in recent years that there's kind of been this boom in the education space? There's a lot more interest in the medical space. And to highlight that, we came up with a little example. So let's say we wanted to make a pharmacy tool for education. We want to take the audio of a student performing a med rec with a standardized patient, and we want to take that audio, turn it to a transcript, and automatically give a score on completeness, correctness, communication skills, and maybe some other dimensions. This isn't something that was completely infeasible pre-2022, but it was a pretty tough problem. You probably need some full-time employees, maybe an NLP scientist, and it's, tens of thousands of dollars probably to implement something like this. Whereas in 2025, this is maybe a couple weeks of work and a few hundred lines of code to get something pretty good up and running. And so this kind of brings us back to this diagram where it's not necessarily what's possible that's changed, but the activation energy to get it done is much lower than it used to be. So what changed? Kind of continuing along the trend of chess to Jeopardy. Now models are more general purpose, and there's a big focus on generative AI, which is AI that's creating new content. And then more importantly, it's not really necessary anymore to be an AI scientist to implement these things. So kind of the technical expertise is taken off as much of a burden.
In other words, you need less Nates.
I'm making myself obsolete. That's part of the goal here. What does someone need to think about if you have an idea and you want to consider how AI could be applicable to it? So there are some challenges with AI systems in general, even though the tools have gotten much better. One is hallucinations. So this is kind of the word that's become part of the vernacular for when the AI says something that isn't true or it makes something up. These models are trained on the internet essentially, and there's a lot of true information, there's a lot of false information. So sometimes you get answers that aren't correct. And one potential mitigating solution is called RAG, or retrieval augmented generation. And this is a technique where you don't just rely on the training of the model, but you have an external data source, which you know is correct, and kind of use that to augment the model. So if you go to the next slide, an example, our PI's name is Dr. Katari. If I ask ChatGPT who Dr. Katari is, he's probably not famous enough yet for it to know the answer. But if we hook up the MCW faculty database as a data source and kind of use it to augment the large language model, all of a sudden it can answer the question. Another way to mitigate hallucinations is called human-in-the-loop design. And this is just a way to kind of validate model output. So models are good at scaling. They do things really fast, but they make mistakes. People are kind of the gold standard for doing things correct, but slowly. So kind of having this yin and yang of validation is important as well. Another challenge is multitasking. If you have your solution, essentially, we're going to throw everything into ChatGPT and let it figure it out. In our experience, it doesn't always work. So this is ChatGPT looking kind of frazzled in the image. And this is kind of an initial version we did where we're asking it to be the patient, come up with reasonable lab values, give feedback. And our solution for that has been making things more modular. So if you remember the panels on the previous image, there's a different panel for lab values. There's a different panel for patient details. And what we've done is we've split up these tasks into different models. So we have a separate model that we can get the labs from, or a separate database. We have a separate model for generating feedback. And in this way, you can kind of optimize each component separately for a better experience overall.
And this has been a really exciting kind of update, I think, in the recent weeks. And when we look really broadly at what a lot of these companies are doing, so you've probably heard of OpenAI, which is the company that made ChatGPT, and Google has Gemini, and Anthropic has Claude. When you look broadly at what they've done in recent months and recent years, the model necessarily like their actual foundational model isn't improving vastly, but what they're improving is the actual utilization of their models. So with ChatClinic, we've tried to actually reflect that in our own user interface. So while we still are using the same model, we're actually improving the utilization by having this modular design. And I think that's where a lot of this stuff is moving. So we're really trying to reflect what the big companies are doing, with our own tool.
An additional challenge is the output structure. So large language models talk in language. So let's say I asked how a student did, it might say, I would give this student this many points, but it gives it to you in a sentence. And let's say you want it in a spreadsheet or in some other format. So there's something you can do called object generation, where you can specify a format for the output to be in ahead of time. And this really makes plugging these models into pipelines much more feasible. So instead of giving a sentence, it gives you something that could be consumed by another component or turned into a spreadsheet or things like that.
Yeah, and this is the specific example of the object generation where you're actually abstracting the specific information that you'd want, and like Nate had mentioned, just the potential of this. This is when would you say this was first started, Nate?
Um, Maybe 6 months ago or so, this started to kind of become popular.
Yeah, and a big problem just previously was you'd want a specific output, but you had very little control of how that output would be generated. So I think this just gives a lot of control to us as administrators of Chat Clinic, and we can really formulate exactly how that output is going to be generated.
And kind of lastly, this is a diagram of kind of how all these components fit together to make Chat Clinic. Um, the less important part is, this specific diagram, but more that you can kind of combine these techniques to make a unified product that works really seamlessly.
Yeah, and this what this has actually materialized in is we were working with Dr. Kavanaugh and Dr. Latourette and on a renal workshop, and these are examples of the four cases we were able to produce. So we had it was a really incredible workshop, but they had crafted four cases that they had in mind in order to have specific educational topics covered that the students would then be able to test their ability to do a med rec and identify different causes of AKI. So you see the different types of cases. So one was a pre-renal AKI, due to shock, and one was a post-renal AKI due to, the crystals due to acyclovir that they were taking. So the actual complexity of these cases it's really limitless, and I think that should be exciting to us as people interested in education, because the cases can be as simple as an appendicitis case and as complex as, a metastatic colorectal cancer. And even we can specify the exact genetics that are driving that cancer. So the possibilities are endless. And again, just another reason to be excited about AI and medical education, and then specifically Chat Clinic at our own institution. So with that, we'll just kind of wrap up and saying, obviously, thank you for the time, and thank you for this opportunity to share our passion and interest in Chat Clinic and AI as a whole. You can scan the QR code if you want to try out Chat Clinic. You'll have to make an account, but then you can play with the many patients we've created and the different clinical specialties. And then lastly, we've really in recent months have eased the process for our opportunity to collaborate with other faculty who have ideas of patients they'd like to simulate. So I have my email down there and Nate's email as well. And then if you want to connect with us on Twitter or X, you can connect with us that way. And if you have these ideas, we're always super open to collaborate in any capacity. So with that, I'll open the floor to any questions that people have about ChatClinic. And if there's more technical questions, certainly direct those to Nate Wolfrath. And again, thank you for this opportunity.
Thank you, Nates. I don't think anybody could replace the Nates. We've really enjoyed working with you. It was pretty seamless to provide you pretty little information on what I was looking for those cases. Um, the students overwhelmingly really enjoyed using the program to practice brand new knowledge. We did it with the PY1 class. And they did those 4 AKI cases a week after they were taught it for the first time. So we got some really good feedback from the students. They really enjoyed being able to start with very little information on their patient and kind of take the lead in the questioning and what they were looking for in order to treat the patient. So thank you.
So Nate, this is Dean McKinnon of the School of Pharmacy. I really appreciate you working with my colleagues here in terms of working up, I think those 4 cases is what I saw. And Nate, number one, I really liked your simplistic overview at the very beginning. I'm going to put in the chat some work we had done in this space in the late 80s. Okay, put your mind around that. It was published, I think, in 91 or 92. And it was computer-based simulations that we did in students and pharmacists at UW. And one of the things that I learned from that was what we referred to as errors of omission and commission in this process. Is if a student, or in this case, learner pharmacist, goes through, what did you look at and what did you not look at, right? And we were so limited by the technology at the time. I remember doing the HTML programming and putting it in a computer, a portable computer I had to take around to different hospitals across the state of Wisconsin. But the premise hasn't changed. And that is to use technology in an efficient manner, right? To ultimately help the learner understand what they know and what they don't know. Now, on the education side, we hope to also use that to help in assessment, right? So I think when you distill it, I'm really excited by this. And coming from contemporary learners like yourself, I'm even more excited about it because it's more practical to what our current students are experiencing. So I just wanted to call you out and say thank you. I do know 2 things also I want to mention. One is one of the new elements to our accreditation standards. So we have ACPE standards, Accreditation Council for Pharmacy Education, like you have LCME in medical education. And the big introduction this year has been, can we demonstrate in our standard or our schools through the standards, we've taught and instructed our students on how to do diagnosis and prescribing. So that's added. So these tools are going to be very useful to help our students understand. The last thing I will say, and it's interesting because I always give the analogy between medicine and pharmacy and how we work. It's like 2 trains going into Chicago that cross on different tracks. You're going this way with the differential diagnosis and the treatment plan, and somewhere in the process, you're throwing off the intervention, in this case, a prescription or something else. And we have nothing else to act upon. We don't know what that prescription was for from a diagnosis. We don't know what the workup was and the lab biology and all that, unless we're in an integrated health delivery system that has access to the EHR. So we do have that in certain elements. So I only put that in there to think about as we think about some of the caveats of challenges as we introduce student pharmacist learners to this. I really enamored with the diagnosis and prescribing piece, but also that other element, when you do that MTM, you oftentimes don't have the diagnosis. So thank you again, and happy to hear any reactions and my colleagues as well.
Well, thank you for those thoughts and comments. It's super exciting to hear that you've been working on this type of idea for so long, and also your willingness and interest to adopt new technology to solve world's challenges is what excites me. I mean, AI is it so uniquely positions us to make this stuff happen. And also, we always are open to collaboration. I think like when you bring in some of those components of you don't always know why someone's prescribed that medication, that's real life. And I think we're constantly trying to shift our patients towards that way. And AI, what's really beautiful about it is that things you specify about the patient will be consistent across interactions, but I think there's this level of flexibility to it as well, where not every patient is the same, just as we do in clinics. So every patient, a lot of times we don't specify the diet, so every diet will be a little bit different, but patients can be complex, and I think you bring up a really good point there, where actually omitting some information is important because that's the case in real life. So thank you again. I really appreciate those words.
I think we have a question in the chat that I can take a stab at. So the question is, are there any cases that focus on social determinants of health or patients who speak different languages? Um, so the answer is kind of yes to the first. I don't think we have any patients in different languages at this time, but I don't think it's infeasible to approach. But we've worked with the psychiatry department here a little bit to kind of make some cases that are more focused on anxiety, depression, risk assessment, things like that, instead of kind of what we showed here, which is a little bit more traditional. You take the history, okay, what's the pathology? What should we prescribe them? And we've also worked on some motivational interviewing cases, which kind of touch on the social determinants of health side a little bit. So I think kind of the highlight there is this is broadly applicable. It doesn't have to be patient comes in with a runny nose. What are we going to do about it? There's a lot of different simulations we can do with this technology.
So you mentioned the OSCEs, right? Have you heard of the concept of TOSCEs? Team-based OSCEs. So could we look at a team-based approach to, this type of work as well, where you have a team looking at the patient, which is really what happens in clinical practice, right? And coming at it from different angles. So something just to put out there, and you're doing incredible work right now, but it's just a different, as on the learning environment, how do we create that platform that allows for that approach?
Again, that's just it's another great thought because we all think about patients very differently, and that's what it's been super fun interacting with so many people of so many different disciplines, is because they approach problems differently. They also care about educating students in a lot of different ways. I know that there's been a lot of collaborations with in recent years, the medical school has really encouraged, like you said, working with multidisciplinary teams. And it's been like with Concordia, with social work, and that sort of thing. So certainly in the future, I think that would be, as we move towards reality of an artificial intelligence application, it's an exciting area for development. So.
Hey guys, this is Mike. Thanks again. Kind of curious. So this looks like it's great for you know, getting information and getting information out of patients. How have you tried, or how well will it do in assessing how well a information is like maybe provided to patients? So in a like a account like maybe a patient counseling scenario or something like that, where you're um collecting a bit of information, but then also providing that information as well. Um, Not sure if this is the best tool for that, but it's just something that came across. And then the other thought I had is, if there is something where you could, present a case and then have the student ask questions to determine whether, for example, a prescription, maybe a controlled substance prescription, should be dispensed, and they have to gather additional information, and that type of thing. Um, would this be an appropriate tool for, either one of those, maybe specific, types of use cases?
Yeah, there's a question I'm seeing in the chat as well, which is sort of related, which is, could this be a difficult patient or
Mhm.
situation to, test more than can you take the history correctly? I think the answer is definitely yes. Um, I mentioned the motivational interviewing or some of the psychiatry cases where, it's not exactly just a history, but really the communication skills as well. And the evaluation piece is pretty flexible too. So we can kind of focus the evaluation on more communication skills or bedside manner. versus more, did you ask the right questions for taking a history related to abdominal pain?
Right.
So I think all the situations you described, a tool like this is well suited for.
And I'd love to add just one point to what you were saying regarding the information given and assessing that. So this has kind of been part of Nate's idea and the other software engineer, which has been this modular design. And what it allows us to do is better assess ultimately how we interact with the patient. So if you look at this bottom left box, previously all the interaction happened in this middle chat box, and it it made it very difficult to assess the interaction because you had to the model was then doing multiple tasks. What the modular design allows for is the tasks to be split up into separate models. So then the model is only focused on one task at a time. What that allows for is greatly enhanced performance. So um, in this bottom left box, this is kind of the final component where you'd maybe provide that information to the patient. We can specify the exact thing that a educator would be looking for the interaction. So if it's how well was that information given, and you want it done on a rubric that looks for specific points of information, we'd be able to look for that specifically. And then the last note with that is I think a lot of people are interested in using AI for grading. One of the things that we definitely are, although we provide assessment, the assessment is really this self-improvement. The grading thing has been a continually difficult thing, seeing some people really interested in that space because with any modeling, and whether it's a machine learning model that predicts a patient outcome or whatever it may be, a false positive, meaning the in this case, in a grading circumstance, maybe they fail a patient, which the positive would be the failure. But let's say the patient didn't actually fail. Those false positives are so detrimental in so many different ways. So at this point, we really are focused on, providing a really comprehensive assessment that improves the educational component of our tool. So I know that wasn't part of the question, but I just think it's a place where a lot of people's minds go, and I think that's where Nate and I both have settled kind of on this topic. So
That's
thank
awesome.
you for that question.
I'll add just one other thing, because it kind of a theme I'm picking up is that, how extensible is this? And people have come up with all sorts of ideas. We've tried to work in some efficiency components. So did the patient, what if you order an MRI? MRIs are expensive. Did the patient really need an MRI? So that you could even do like a medical waste component. There's so many different directions that you could take something like this.
And I'll jump in there too, guys, with the feedback that the program provides the user. Our students loved getting the instant feedback on what they did wrong and what they did right in the communication, not just the diagnosis and medication management, but also if they didn't word things correctly with the patient, it called them out on that. So that I think was valuable from an instructor standpoint, but also the students loved getting that instant feedback on how they did.
That's awesome. Um, can I ask, and I don't mean to be, awkward, and if this is off base, just tell me. Curious for you guys, what your like business model is for this. I'm assuming this is not, or this is something that you're going to be involved in for a long time, or maybe, develop it and turn it into your, and turn it into a, business and, work with many different clients on this. It seems like a fantastic opportunity. And, certainly as far as, working with you guys in the future.
Yeah, great question. It's a space we're still trying to figure out. Right now, we're especially within our own institution. We just really want to see the product grow. I mean, I think Nate and I are both really grateful for the opportunities we've had at MCW, and to see our tool utilized at our own institution is just it's really exciting to us. And it hasn't become so costly that we feel we need to charge money for it within our institution. But, as that interest continues to grow, I mean, I've been contacted from people in different countries with they have different interests, different institutions have had interests. And as that interest continues to grow, I do think there will definitely have to be kind of a shift towards some level of monetization, just so when the expenses become so high, Nate and I are not eating ramen noodles every night. Um, so I think it's definitely an area we're moving towards in the future, but we don't have any immediate plans from that standpoint.
Thanks for sharing.
Mhm. Thank you.
Yeah. I also had one other question. This is not necessarily related to Chat Clinic, but you showed another tool earlier in the presentation. Was it Consensus?
Oh, yes.
Yeah, which I was not familiar with it. I'm not sure if anybody else here is also familiar with that. It looks kind of like an AI version of PubMed or something like that. But what have you guys used that a lot? And what's your impression of, or what's the general consensus about how well it works?
So this is an area that I am extremely excited about. Probably it's second place to Chat Clinic, which
Yeah,
is just this ability to ask clinical questions and then getting responses. So Consensus was the first to do this,
yeah.
but the other group that's doing this even at a better scale is now called Open Evidence. And Open Evidence is free to anyone who is some level of care provider. So it's open evidence, one word. I forgot exactly who was driving it, but New England Journal of Medicine is heavily involved. And any clinical question, truly any clinical question, it will actually synthesize a really comprehensive response with citations for each component of the response. So when I'm trying to find and especially you guys as well, this is a huge pharmacy application. Does this drug impact this condition, or is there some interaction between these things? And maybe it's been only identified in one case study back in 1990. Well, it's still good to know, and open evidence will actually be able to synthesize that information so that you get those answers. So, I mean, the ability to use AI will become a skill in the future, and it will make us better providers in any
Hmm.
circumstance. So, I just continue to encourage people to look for those examples, and open evidence is one that I cannot speak higher of. And sorry, Nate, I saw you were unmuted. Did you have anything to add with that?
No, I was gonna mention open evidence. It's really good. It's super helpful. It's kind of like the slide that we had the LLM hooked up to the MCW faculty database. It's like that, but with, PubMed instead of the faculty database.
Hmm.
It's a great tool.
Awesome. So AI is being used in our, literature evaluation and searching areas as well. So much for mesh terms searches and things like that, right? That's awesome. Thank you for sharing that. That is also brand new to me today. So I'll have to check those out too. All right, folks. Any additional questions for Nate and Nate today? All right. Well, seeing none. Um, Oops, George, did you have a question? Were you
Well, I was
unmuting?
just going to ask, we've got two of our students on rotations, right? Academic appies right now.
That's correct.
Have they been involved in the pilot we did with Dr. Tourette? Was Bonnie that mentioned or no?
No, it's our current PY2 class that went through
Okay,
it last May.
thanks. Appreciate it.
Sure.
Right. Awesome. Well, thank you again for sharing this, and thank you for sharing your contact information. I'm sure it generated a lot of ideas and And thank you for working with our faculty, and look forward to some continued collaboration with you guys. And again, appreciate the time and the knowledge, enthusiasm, and passion that you shared today.
Thank you. We really appreciate the opportunity. This was great to get a sense of what you guys are doing and your interest in the area. So hopefully we get to collaborate in the future.
Wonderful. Thanks again, and we'll hopefully be talking to you guys soon. I could share the link to the recording with you if you'd like it for your purposes as well. So thank you.
That's great. Thank you
All
guys.
right.
Thanks.
Everyone have a great day.